Although Parkinson's disease feels like a modern health crisis, the condition was actually described more than 200 years ago. In 1817, a London doctor named James Parkinson published a short but influential paper titled An Essay on the Shaking Palsy. In it, he described six patients who had a distinctive combination of symptoms, such as trembling hands, slowed movement, and difficulty walking. At the time, the condition was called the shaking palsy, and eventually it was named as the Parkinson's disease. And the most pressing issue we face today, as the number of cases continues to rise worldwide, and what can we do about it, such as managing it, understanding it, and most importantly, what are the ways so that we can reduce the chances of getting it. In 1990, around 2.8 million people worldwide were living with Parkinson's. In 2021, it's over 11.8 million people. That's over a four-fold increase in just 3 decades. No other brain disease looks like this. Parkinson's is the fastest growing neurological disease in the world. It is estimated by the year 2050, it might double to 20 million people by that year. But here's the surprising part. Some prominent researchers now believe that Parkinson's may actually be preventable. So, what is driving this global search? Let's break it down, one after the other. Let's first understand what it does to our brain.
Parkinson's disease occurs when nerve cells in a region of the brain called the substantia nigra begin to die. These cells normally produce dopamine, a chemical messenger that helps different parts of the brain and nervous system communicate to control and coordinate movement. When these nerve cells are damaged or lost, dopamine levels in the brain decrease. As a result, the brain areas responsible for regulating movement cannot function properly, leading to slower and irregular movements. This loss of nerve cells happens gradually. Symptoms of Parkinson's disease usually appear only after some of the nerve cells' activity in the substantia nigra has already been lost. This condition creates symptoms such as movement-related ones may include tremors at rest, often in your hands, arms or legs, muscle stiffness or rigidity, changes in posture and walking, trouble while turning, less facial movement, quieter voice, cramped handwriting, slowed movement. And non-movement symptoms may include loss of sense of smell, sleep problems like restless sleep, mood changes like depression or anxiety, constipation, urinary urgency or digestion problems, sexual dysfunction, or drooling. Currently, it's believed a combination of genetic changes and environmental factors may be responsible for the condition. Scientists estimate that about 14% of cases of it are linked to a genetic cause. A number of genetic factors have been shown to increase a person's risk of developing it, although exactly how this makes some person more susceptible to the condition is unclear. Some researchers also feel environmental factors may increase a person's risk of developing it. It's been suggested that pesticides and herbicides used in farming and also traffic and industrial pollution and also solvents may contribute to the condition. Most people do not have a clear environmental cause for their Parkinson's diagnosis, and because many years can pass between exposure to an environmental factor and the appearance of its symptoms, the connection is often difficult to establish. However, there is some strong observations which are presented in the book The Parkinson's Plan, where the two scientists highlight how environment is causing it majorly. Here's something surprising. Studies have found that golfers may face a significantly higher risk of developing it. In fact, research suggests that people living near golf courses can have up to a 126% higher risk. But the reason isn't golf itself. It's the chemicals used to maintain golf courses. Golf courses are often treated with large amounts of pesticides and herbicides to keep the grass perfectly green and weed-free. Many of these chemicals are known neurotoxins. So, how the diet helps to manage the condition? A balanced diet supports overall well-being and helps the body cope with Parkinson's symptoms. Eating whole foods like fruits, vegetables, whole grains, legumes, and lean protein while staying well hydration helps maintain energy and health. Constipation is common in it because digestion can slow down. A high fiber diet along with adequate water intake and regular physical activity can help relieve this problem. Exercise is one of the most powerful tools for managing Parkinson's disease. Activities that raise the heart rate and challenge balance can improve walking, coordination, strength, and overall physical function. Regular movement may also slow the progression of motor symptoms. Even everyday activities such as household chores, gardening, or shopping help keep the body active and prevent a sedentary lifestyle. Exercise also benefits the brain by supporting neuroplasticity, the brain's ability to maintain and form new neural connections, which may help counter some effects of the neurodegeneration in Parkinson's disease. Practical steps to reduce Parkinson's risk. Researchers like Ray Dorsey, Michael Oken argue that many cases of Parkinson's may actually be preventable. In their book, The Parkinson's Plan, they outline 25 practical actions people can take to reduce exposure to environmental toxins which are linked to the disease. Here are few of the most important ones. First, clean your air and water. Use the purifiers regularly. Second, wash your fruits and vegetables thoroughly. Even foods labeled as organic can carry some pesticide residues. Third, push for pesticide-free environments. Places like schools, workplaces, parks, and even golf courses are often sprayed with herbicides and pesticides. And finally, exercise regularly. Parkinson's disease is rising worldwide, but the story is not entirely bleak, because the more we understand its causes, the more opportunities we have to prevent it. And protecting our brain and overall health may start with something surprisingly simple, which you can do daily. Exercise a lot in a cleaner and unpolluted environments, reduce toxins and pollutants exposure, and harmful chemicals wherever you can, and also make sure you spread the awareness of this disease to your loved ones, and also keep yourself updated regarding the latest science.